Hello, everyone. It's your guy, your man, Mr. Talk 718 with Talk Life, the podcast. Tonight, my conversation is based on the health conditions that disproportionately affect black women. This is the second part two of an eight-part series. Tonight, as you can see, these are the breasts, right? And this depiction of the breast is very serious, and we're going to get into what this picture actually means, okay? So I'm going to start now, and I'm going to move on from this right here. This is a few pages. I did a little slideshow, did some research, and I'm getting this information out to you, ladies, because I love you dearly. I think it's very important that we teach each other. How they say, each one teach one. So not only do I worry about your mental state, about the toxic people in your lives, about how to be loved and how to be treated, how to be protected, I also want to discuss situations that go on in your life as far as health. So with that being said, I'm going to jump into this, okay? Breast cancer. Black women have a 1 in 9 chance of developing breast cancer. For white women, the odds are 1 in 8, according to the American Cancer Society. But black women are more likely to die from the disease. White women's probability of dying from breast cancer is a 1 in 37, while black women, they're 1 in 31. So you can see it's not much of a difference. It's almost equal. It's almost equal, but when you throw in per capita, it's a lot different, right? Estimated new cases. This is from the Cancer Statistics Center. Cancer.org. Estimated new cases in 2020 is 279,100, while estimated deaths in 2020 is 42,690. Incident rate from 2012 to 2016 is 125.3, the average annual rate per 100,000. And this is adjusted to the 2000 U.S. standard population. And the death rate from 2013 to 2017 is 20.3%. And this is also per capita, 100,000. And the standard population rate for Puerto Rico are not in this. So we don't have to worry about Puerto Rico in this one. But this is from 2011 to 2015 as far as the rate for Puerto Rico. The reason why black women are more likely to die from breast cancer than any other group are very complex. Adrian Phillips, medical doctor, oncologist at Weill Cornell Medical and New York Presbyterian, an interplay between genetic biology and environment. And here, as I said earlier, this graph actually shows you the adjusted rate from the 2000 U.S. standard population, where non-Hispanic whites are 130.8, while non-Hispanic blacks are 126.7. And then we can get down into like American Indian, Native American. You see it drop, right? But this is an annual rate per 100,000 adjusted to the 2000 U.S. standard. But we're going to get into this. You see this here, and I'm going to show you how the incident rate does not equate to the death rate, okay? Breast cancer, along with the BRCA mutation, which may be higher in black women than experts previously thought. Black women are more likely to get triple negative breast cancer. Remember that picture that I showed you? The depiction, that was a depiction of a triple negative breast cancer, a particularly aggressive form of the disease than women of other races. Then there are the environmental factors Dr. Phillips mentioned, like socioeconomic issues that lead to trouble accessing early diagnosis and treatment. So now we already know when we get to our communities, I said it in the last video and I'll say it again, there's nothing there unless we take it back, because they have nothing but Chinese restaurants and fast food. And, and this is, most black people, we live in inner cities, right? Unless you have good money, we're living in inner cities where the population is very dense and there's nothing there to actually help us stay healthy. So you might have one health center like in one area, and then people from all surrounding areas have to come to that one or maybe two health centers, right? And do they specialize in certain medicines, right? So, all of that, all of those things play a major key in early treatment and preventive health, right? Anyway, so in the last slide, we talked about uh, BRCA right here, BRCA mutations. I'm going to just give you a definition of what a BRCA mutation is. A BRCA mutation is a mutation in either the BRCA1 and BRCA2 genes, which are tumor suppressor genes. Hundreds of different types of mutation in these genes have been identified, some of which have been determined to be harmful, while others have no proven impact. Harmful mutations in these genes may produce a hereditary breast ovarian cancer syndrome in affected persons. Only 5 to 10% of breast cancer cases in women are attributed to BRCA1 and BRCA2 mutations, with BRCA1 mutation being slightly more common than BRCA2 mutation. But the impact on women with the gene mutation is more profound. Women with harmful mutations in either BRCA1 or BRCA2 have a risk of breast cancer that is about 5 times the normal risk, and a risk of ovarian cancer that is about 10 to 30 times normal. The risk of breast cancer and ovarian cancer is higher for women with the high risk BRCA1 mutation than with a BRCA2 mutation. Having a high risk mutation does not guarantee that the woman will develop any type of cancer or imply that any cancer that appears was actually caused by the mutation rather than some other factors. And these are the chromosomes, right? So you got the chromosomes 17 and 13. Well, in the chromosome 17, you get the BRCA1. That's the BRCA gene 1 mutation. And as you can see, it's going up. So I'm assuming if we do a count, I'm not even going to go there. I'm still not, I'm learning like you are. But anyway, and the BRCA2 gene is in chromosome 13. As you can see, it's going up from the bottom to the top, right? So this is what a BRCA mutation is, if you did not know. And I would suggest anyone that's watching to look these things up, especially if you're women or if you're brothers with wives or even men, because men now, they have found out that men actually get breast cancer. So brothers, if you're out there and you're listening to this, don't take this as just a female thing or a woman thing, because it's not. This is really centered and directed to the ladies. But brothers, if you're listening, understand we too can get breast cancer, because men, we do also have breasts. We call it chest, but nevertheless, it's still a breast, right? All right, let's move on. This here is a BRCA1 mutation by race, age, and ethnicity. BRCA1 mutation rates vary by race and ethnicity, age. Researchers have found that a gene mutation linked to breast cancer is more common in some ethnic or racial groups of breast cancer patients than others. In all groups, a larger percentage of young breast cancer patients had the mutation than older patients. So the older you get, it seems to shrink. That's what I'm getting here. So I've read some stats, and it did show that once you reach over 60, it's less, the rate go down. So for Asians, BRCA1 prevalence, all ages, 0.5%, African Americans, 1.3%, non-Hispanic white, 2.2%, Hispanic, 3.5%, and Ashkenazi Jews, 8.3%. But this one here with the Ashkenazis is based on 3 patients. So we can't really take this into consideration, because 3 people aren't enough to actually get a proper information, But then when you go under 35 in age, right there, under 35 in age, Asian Americans is only 2.4%, while African Americans are at a 16.7%. That's staggering. That's higher than anybody else. And if you combine it, there's still higher, with the exception of the three people that were Ashkenazis. So you got African American at 16.7%, white non-Hispanic at 7.2%, Hispanics at 8.9%. You do the math. You do the math. Still doesn't add up. Back to what I was saying earlier before I had to break down what I was talking about. Breast cancer. I'm always going to read the title because it's about breast cancer. Much like metabolic syndrome, lowering your risk of getting breast cancer mainly comes down to exercising, maintaining a healthy weight, not going overboard on alcohol, and quitting smoking. And even though major organizations haven't found a notable benefit from breast self exams, many doctors strongly recommend you check your breast monthly so you're aware of any changes. So, ladies, if you're out there and you're still young, don't think that breast cancer can't happen to you. It affects all ages. You might think because you're young, just like a person that's slim and they think that they're fit, but if you ask them to run a mile, they can't do it. You have to take care of your body, and your body will take care of you. Just like you take care of that car. You got a brand new car, and you want to make sure nothing is going to happen to it. You take it to the shop. You make sure it's clean. You get everything done. Your body is the same thing. Your body is the same exact thing. Your body is your car, but you have this car, your body, for your entire life. So when you die, when your body die, you die, right? So we're gonna try to take preventative steps to make sure that you ladies out there are doing what you have to do to live longer. Because cancer, breast cancer is real. That's the number 2 on a list of 8. So that tells you something, right? This is serious. So I'm going to just tell you what metabolic syndrome is, because when I talk about some of the things, I'm going to be saying some things, and I need you to understand what I'm talking about so you can get a full understanding of why it all goes together. Okay, so like it says metabolic syndrome. Metabolic syndrome is a clustering of at least 3 of the following 5 medical conditions. I spoke about that in the last video, right? Heart disease. So abdominal obesity, high blood pressure, high blood sugar, high serum triglycerides, and low serum high density lipoprotein, HDL. Metabolic syndrome is associated with the risk of developing cardiovascular disease and type 2 diabetes. In the United States, about 25% of the adult population has metabolic syndrome, a proportion increasing with age, particularly among racial and ethnic minorities. So again, we as a people have to do better with our health, because not for nothing, we are the ones who's inflicted 25%. That's a big number. And when you think about people of color, it's mostly blacks and Hispanics, right? And then you if you want to break it down by gender, that's fine too. But when you put it all together, the number is still higher. So about 25% of the adult population has metabolic syndrome, a portion increasing with age, particularly among racial and ethnic minorities. Insulin resistance, metabolic syndrome, prediabetes are closely related to one another and have overlapping aspects. The syndrome is thought to be caused by an underlying disorder of energy utilization and storage. The cause of the syndrome is an area of ongoing medical research. So you know how they say make sure you get out in the sun and get your vitamin D, because vitamin D actually helps you? Well, that's kind of like a true statement. The sun is very important to healthy lives and healthy lifestyles, right? So now back to the breast cancer. I'm going to give you a few things, a few breast cancer rates among black women and white women. Black women and white women get breast cancer at about the same rate, but black women die from breast cancer at a higher rate than white women. Compared to white women, black women had lower rates of getting breast cancer incidence rates. Remember I was talking about that earlier, the incidence rates? It was higher. Incident rate and higher rates of dying from breast cancer. Death rates between, let me say that again. Compared with white women, black women had lower rates of getting breast cancer, okay, incidence rates, and higher rates of dying from breast cancer, death rates, between 1999 and 2013. During this period, breast cancer incidence went down among white women and went up slightly among black women. Now, breast cancer incidence is about the same for women of both races, which is true. The stats for 2020 shows that it's pretty much equal. There is no higher with the incidence rate. So it's just like you can get 50 women together, black, white, Hispanic, or whoever, and put them in a room, and they all might have, like, say it's 10 each, and all 10 of the women have the same incidence. So it's like 9 out of 10, right? So if you get Asian, black, African American, white, and Hispanic, 9 out of 10 would be pretty much getting the same situations going on in their lives. They might all get a cramped toe. That's 9 out of 10 people with a cramped toe per race. But in this study is basically talking about blacks and whites. So if you got 8 women, 8 out of 10, that's making it equal in the incidence rate. But that's about it. Nothing else. Death from breast cancer are going down among both black and white women, especially among younger black women. But breast cancer death rates are at 40% higher among black women than white women. You see what I was getting at? And this is the per capita thing. This is not like 1 out of every 10. This is like 100 out of every 100,000, or 1 out of every 100,000, or whatever the number is outside of inside that 100,000. So if you got 200,000 and 8 people died out of every 100,000, you have 16 deaths. America is big, so the population is dense with multiple races. But when it comes to black and white women, 40% higher death rate from breast cancer. And I said earlier, is because, again, we don't have everything that we need in our communities. Our communities are really, they need to get up, they need to big up, they need to get lit, as they would say. So this is the breast cancer by race and ethnicity. So remember earlier I showed you a graph kind of like this. Well, that graph was basically talking about the incident rate. Well, right here we're talking about the death rates between 2013 and 2017. Breast female by race and ethnicity, non-Hispanic black 28.4, while non-Hispanic whites is at 20.3. And then you go down and you see everybody else is, in the teens. But when it comes to African American women, they're up by 8.1%. And this is the average annual rate per 100,000. That's a big number. Key findings. Compared with white women, breast cancer incident rates were higher among black women who are younger than 60 years old, but lower among black women who are 60 years old or older. Remember I said that earlier? Breast cancer was more likely to be found at an earlier stage among white women than among black women. Among women who are 60 to 69 years old, breast cancer death rates dropped 2% per year among white women compared to 1% per year among black women. That was the largest difference by race. Now, I'm going to tell you what can be done. It might sound kind of corny, but this is what they say can be done. A lot of this stuff basically is based on health, right? And working out, exercising, changing your dietary meals, and I mean, you don't have to eat meat. You can eat meat, but you just have to have a portion control. I'm diabetic, so I can tell you that's one of them symptoms, right? And in order for me to get better, I had to change up a lot of things. Like I started working out. I went from eating meat to now being plant-based or vegan. You know what I'm saying? And it's helped me. I've dropped like 40 pounds in a year. So I want to say this right here is information that's going to help you get your life back on track before you get any of these illnesses. Black women are more likely than white women to get triple negative breast cancer. So again, that picture I showed you earlier, that was a picture of triple negative breast cancer. This kind of breast cancer is often considered the most aggressive, and it could come back after treatment. Scientists are doing research to learn why some women are more likely to get this kind of breast cancer and to find better ways to treat it. Through this work, women have become more aware of the different kinds of breast cancer. Public health agencies are working to make sure all women are screened for breast cancer as recommended, and those who are diagnosed with breast cancer can get the best treatments. They also are helping women reduce the risk factor that raises the chances of getting breast cancer. Together, these efforts could reduce racial disparities in breast cancer. But now, just remember what I said earlier. Um, it's 2020, so when it comes to the incidence, right, of breast cancer, it's actually equal between blacks and whites, women, right? Anyway, I'm about to cut this off because this is just part two, and I don't want to, you know, run your ear off. I can talk for 40, 50 minutes at times, but I'm going to make this nice and short. I'll put the information out. I hope you ladies out there find some of this information useful. If you want to find out any more information, I would suggest going to American Cancer Society. That's at cancer.org. Or I would say also you can go to the Center for Disease Control and Prevention at cdc.gov. And when you're in cdc.gov, just look for cancer. Go to the search menu, put cancer in, and it's going to give you information to talk. That's going to give you information that's talking about cancer, and it's really good information. Cancer Society also have downloadable PDFs. So if you want to know anything about anything about key statistics, cause, risks, and prevention, detection and diagnosis, understanding your diagnosis, treatment and side effects, for the ladies who had to get rid of their breast with surgery, breast reconstruction, and the steps after treatment, you can also go to the ACS. That's the American Cancer Society. Ladies, I love you with all my heart. Just remember, you got brothers out here that's fighting for you because we know how important you are. And to anybody else that's out here, don't forget to subscribe, like, and comment. If you don't like my content, I would prefer you to write a comment so I can improve on my content. You know what I'm saying? I'm new at this and I can only get better, but I can only get better with you guys' help. All right? Love is love, Black Equality Movement, and let's just continue to talk life. Peace.